But let's start with something that people are just hearing about now in 2020. If they've never heard about the others, they're starting to realize that with COVID, Black and brown people are suffering and dying at higher rates than whites. So talk to me about your vision on what's going on.
Well, let me say first that I think this is a very complex topic, and I want to honor the fact that there's so many experts in this field, and I would say that, like you described, I've only been talking about race more recently, and I would even say that the way that I've considered my care of patients is that I take respectful care of my patients regardless of their skin color. And what I realized over the past year and a half is that's not enough. That's not enough. It's a step in the right direction, but it's nowhere near what's needed for the crisis, the racial pandemic that we're facing. So you asked about SARS-CoV-2, the virus that causes COVID-19. And, the data are very troubling. So the worst disparity that I've seen documented, I'm going to put my geek hat on first, is a study that was published by Yale in April, showing that Black folks were dying at 3.57x the white folks, 3.57x. So that is a horrible statistic. What I've seen, as I've followed there's a racial tracker that's looking at COVID statistics, and this is a really interesting piece of work that's been put forth by Ibram X. Kendi and his anti-racist center, his Center for Anti-Racism Research, together with the Atlantic, some journalists from the Atlantic, and what I just looked 2 days ago, and what I saw was that with what he's tracking in the US, Blacks are dying at about 1.5x the rate of whites. So not quite as high as that statistics from April, but still alarming. So I think those are, the truth is probably somewhere in that range, a 50% higher risk of mortality among Black people.
So let's talk about the why. And actually, this will certainly apply to the other health disparities we see in Black people, like with cardiovascular disease, Alzheimer's, obesity, diabetes, and on and on. But let's talk specifically, like, why is it? Why is it that Black people are dying at higher rates from COVID-19?
Well, I'd love to riff with you on this because this is, the why I think is quite complex. And so we could start first with some of the underlying health conditions, most of which I think of as driven by social determinants.
Yeah.
So we can get into the details of that. But I also want to say, in kind of a meta message around this, I started to post more about racial disparity. I was struck by a couple of things. I was really struck by the number of people who would respond to my post about COVID-19 or my post about, twice the rate of Alzheimer's in Blacks versus whites, or, 4x the increased risk of maternal mortality. Folks would say, oh, well, it's what they eat. And so this is one of those places where we need to get really clear. And I hope you'll help me with this. This is socially determined. Race is socially constructed. It is not a difference in biology. It is not a difference in genetics. You and I are 99.9% the same genetic code. We maybe have a slight difference in our melanin. Otherwise, there's not a difference in our biology. So I think when we get to the why, there's so many reasons for it. So certainly the risk factors are different, like hypertension. We know dementia is a major risk factor, and that's twice as high in Blacks versus whites. But there's these social determinants that I hope we can talk about.
Yeah, I'd love to. And in fact, for those of you who have never heard of this, the social determinants of health, at least for America, we typically think of these 5 factors. The social determinants include things like economic stability, education, of course, health and health care, the neighborhood, the built environment around you, and the community context or the social context. So when we're talking about the social determinants of health and how Black and brown people are at a disadvantage, as you point out, Dr. Sara, it's not about our genes. It's not something within our biology necessarily. But if we look at, well, let's talk about two different things. I definitely want to talk about the stress and the weathering that we see with racism, because that is the social context of what impacts our health. But we can also just talk about the basic things. Like I know what you're talking about when people say, oh, it's because the reason that Black people are, heavier or they have more diabetes, it's because of what they eat. And it's not just a behavioral choice of what they put in their mouth. It is determined by what they're brought up to hear as healthy and not healthy. And of course, what's available. Like we talk about food deserts. Like there's a paucity. There's not enough healthy food choices in many of the neighborhoods where young Black people are being raised. And so they eat what they're taught to eat, but also what's actually available.
That's right. I think this issue of availability is so important. And it's, if we take a step even higher to policy, kind of public policy, and the politics that we have in the U.S., that's where we see racism just as a through line for all of these conversations. And, I live in Oakland, California. I'm right on the border between Oakland and Berkeley. It's a very diverse city. And as you described, there are parts of Oakland that have a farmer's market 3 days a week and have access to, every grocery store you could imagine. And then there's parts of Oakland that are food deserts where it's very hard, even if you're extremely motivated and you have the money, to get the vegetables that you need.